Thank you and welcome everybody who is joining us this morning for a very special interdisciplinary rounds. So my name is Dr. Zini Ng, and I am one of the clinicians on our primary care service, and I will be your host for this morning. And today we are going to be talking about that very special topic about spay neuter and ideally when spay and neuter should be performed. Because no matter who you are in this veterinary profession, whether you're small animal, large animal, lab animal, or anything else, you're absolutely going to encounter that question. Because as veterinary professionals, we know that there's no question or any doubt that we should be spaying and neutering our animals. We've always been told that it's part of that sterilization is part of our duty, and that in the past we've always been told that we should do it by 6 months of age. It's our biggest decision that we can do for our pets to help them live happier, healthier, and longer lives. But obviously, these recommendations for when to spay and neuter have sort of changed with the times and with the data that is continuously growing. So this morning, we are going to challenge those recommendations, and we're going to talk about these recommendations in the context of the recent data that has been published, as well as from the experts from our different services who we have here. So I want you guys to kind of take a critical eye at this, and I want you to not only imagine yourself as a veterinary professional answering questions and counseling owners into when to spay and neuter your animals, but also yourself as a pet owner. If you're lucky enough to have that puppy, to kind of ask yourself, when is the right time to be spaying and neutering that animal? With that being said, we'll get started, and we will be going to the oncology service first, where we will first be hearing from Dr. Brian Meyer, who is our oncology specialty intern. What we'll ask during the session is that if you can please use the chat to ask whatever questions that you might have. I'll be here to moderate. You can also private message me if you also do have any other questions. But with that started, Dr. Meyer, are you there and able to share?
Yes, I am here. Give me 1 second. Let me see. How's that?
Great.
Can everyone see and hear me?
Yes.
All right, sounds good. We'll get things moving. All right, so like Dr. Ng was saying, we're going to be looking at spaying and neutering in terms of an oncologic perspective. So, starting off, there was a very nice 2014 review of just kind of the effect of gonadal hormones and the effect of gonadectomies on specific type of dogs. And I think that this table that we have presented forth here is a very good summary of just kind of what risks are presented. It has a great list, and I think it's a great first reference for any general practitioner to look at. So, we can see that there are obviously tumors with increased risks post-castration and post-spay, as well as the opposite, tumors with decreased risks. And if you notice, there are 3 distinct breeds that are talked about in this table, specifically golden retrievers, Rottweilers, and Vizslas. So the reason they have these listed is because there are specific studies and specific papers looking at the effects of specific cancers in these types of dogs after spaying, after neutering, and looking at the prevalence of risk once these procedures are done. So that's a lot of what we're going to focus on initially, along with looking at generalized papers of, overall, what is the risk of spaying and neutering in general versus the specific breeds that have been researched and been studied in terms of specific cancers. So starting off, the biggest one, the one we most commonly see, lymphoma, is that affected by spaying and neutering at all? And the answer is yes. We do see some incidents, some higher incidents of lymphoma and higher risk of lymphoma in dogs that are spayed and neutered at earlier ages. So the big studies that we see here, mainly a 2009 study in dogs looking at lymphoma over the veterinary medical database. This was a very large study, and they looked at the prevalence of lymphoma in different intact versus altered animals, and they found that the prevalence was actually the lowest in intact females overall. And so, it was a significant difference there. And in males, there wasn't really much of a significant difference between spaying and neutering, but in females, we actually did see it. And then more recently, they looked at specifically a 2013 study in golden retrievers, where they did see that neutered males were 3 times more likely to have lymphoma than intact males. So the reasoning behind why we see that, or why there is an increased risk, is still under works and still a little bit unknown, but we are working on trying to find it. And we do know that there is increased incidence. Moving along, we look at our other most common tumor that we see out in practice, mast cell tumors. So again, there are a couple of papers out there, and the golden retriever paper is the same one as they saw in lymphoma. So they did multiple different tumors in golden retrievers, and we saw increased incidence in altered animals. So overall, we saw an increase in spayed females, and like it says, 4.1 times more likely in multiple different breeds. So that was a large study done over multiple different breeds, looking at mast cell tumors and different tumors. And then again, the golden retriever study, we do see that spayed females are higher risk. So, it's not just that we're seeing altering in general as a risk, but we are seeing different tumors being expressed in golden retrievers through, are they spayed females? Are they castrated males? So it is something to think about. And then the other breed seen is Vizslas. Vizslas were looked at, and there was a full study done on multiple different tumors in this breed of dogs. And again, they did see a higher incidence of mast cell tumors in both males and females. And so all in all, we can see increased risks of mast cell tumors when altering is done. And so it is, again, something to think about. And that's kind of the emphasis that I'm putting on here, is that, we are seeing a lot of increased risk, but at the same time, these are in specific breeds. And overall, we have to look at the entirety risk of a breed before we decide, should we wait, should we go ahead and go for it. Hemangiosarcomas, obviously a very aggressive tumor and something that we definitely worry about in animals. So we're trying to prevent it as much as we can and trying to, elongate lives as much as we can. So as we know, splenic hemangiosarcomas are more prevalent in large breed dogs. And they have been seen that spayed females do have the highest prevalence. So in golden retrievers, golden retrievers that were spayed later in life, so ones that have had some exposure and then have had that exposure to gonadal hormones taken away, they have been more likely to develop them rather than in dogs that remain intact or dogs that are spayed early. And then, believe it or not, spayed Vizslas were at a 9 times higher risk than intact dogs. So, this reiterates the point that in these specific breeds, we are seeing a higher prevalence when we alter these animals, and even in these highly aggressive tumors. So there is some research behind, looking at how do these affect the exposure to these tumors? Where do gonadal hormones work in terms of, how do they inhibit? How do they alter the cell? Is exposure to it going to be preventative? Is the lack of exposure going to make them resistant to other hormones and other things that could be helpful in our fight to prevent these tumors? And of course, that's splenic. So looking at the other half of these hemangiosarcomas, the ones that are definitely the more severe, the ones that we really can't do anything about, the cardiac hemangiosarcs. A lot of these have older papers because once they've answered the question, they haven't really focused on it again. So this most recent paper was a 1999 study looking at cardiac tumors in dogs, and they did find that there was a 4 times higher risk in spayed females, and that was over just generalized breeds. There wasn't any specific breed that was focused on. So Again, lymphomas, mast cell tumors, hemangiosarcomas, all tumors that we are familiar with and that we probably all know pretty well. We are seeing more prevalence that spaying and neutering these animals can increase risk. And then this is kind of the slide that I wanted to focus on a little bit more, because there's a lot of misconception on the benefit of spaying animals when it comes to mammary gland tumors. So the numbers we hear every day are, we hear that OHEs before the first cycle, there's a 0.5% chance of getting a mammary gland tumor. Before the second cycle, 8%. After the second cycle, 26. The misconception that we have about that is that we think that that's a blanket statement, and it actually refers to the risk of each breed. So take something like Cocker Spaniels, who do have a higher risk. Those dogs actually, it's the percentage that the risk has initially, the altering becomes the 0.5% of the initial risk. So if a dog breed has 24% chance of having mammary cell carcinoma in its lifetime as an intact dog, then spaying before its first cycle will be 0.5% of 24%. So it's not 0.5% period, it's a percentage of a percentage. So a fraction of a fraction is the best way that I can describe it. And so it's kind of skewed our idea of how greatly spaying and neutering benefits, or at least spaying benefits these female dogs, because we automatically think, we're taking away the risk of mammary cell tumors completely, whereas it's actually quite negligible, the risk that they have versus the risk that they have when they're altered. And so at the same time, there is another paper looking at OHEs and mass removal in older dogs, where they did see a decreased risk of recurrence, and that was specifically in benign masses after spaying. And then wanted to look at osteosarcoma as well. Thank you, Dr. Ng. Osteosarcoma as well. So the age of neutering affects the incidence of these. And so a 1998 study looking at purebred dogs specifically, they did see a twofold increase in neutered dogs. And then in terms of Rottweilers, we know that Rottweilers are one of the breeds that are more predisposed to these osteosarcomas, as well as other large and giant breed dogs. But they saw that later neutering was associated with lower risk. And so waiting a month actually led to a 1.4% decrease in the likelihood of getting these bony tumors. So as the longer we wait each month, the lower chance it is. And so going to one of the most recent papers, the ones that we were actually, that spurred this topic, we looked at other breeds that were affected. So you see there is evidence that from the veterinary medical database, that Australian cattle dogs, Australian shepherds, Bernese mountain dogs, border collies, you can read all of these breeds, but they all do have higher incidence of cancer happening when they're altered versus when they are intact. So it is something to think about. And overall, from an oncologic standpoint, the recommendations that we have is just based on the literature. We need to know the high risk breeds. So Goldens, Vizslas, Rottweilers are just some examples. We also have there's the classic breeds that we see that get these tumors. So hemangiosarcomas in German shepherds, any large breed dog with osteosarcoma. The point of that I'm trying to make at this is that we need to look at the other factors, and this is something that we look at when we are talking about owner-owned purebred dogs. In a shelter setting, this is not something that needs to be greatly enforced. We are still more worried about population control, but when it comes to an owner who brings a new puppy to you, and it's a golden retriever puppy, and they're great and they're adorable, and they want to know when they want to spay it, then maybe waiting until they are skeletally mature and waiting until that year is the right course of action, just based on the literature that we have. That's all I got for you. I wanted to focus on the main points there.
Thank you so much, Dr. Meyer. Really appreciate that. Really great short and concise summary from a lot of different data points. As far as questions that we have out there, it looks like Dr. Tobias had asked a question about regarding one of those studies. Dr. Tobias, are you there?
Yeah, I am. I just wanted to make sure that we mentioned whether or not those studies looked at the ages of the animals, since there are some studies that say we have either longer lifespans of animals that are neutered, or potentially we're looking at animals that are intact because they're young, and we have animals that are then neutered. And so obviously those are the older populations. So I think it's important to bring up, what did those studies say about the age of the animals in those studies? And does longer lifespan have any effect on the occurrence of those neoplasms?
So what we did see in those studies is that a lot of times these breeds, depending on the tumor, of course, obviously mammary gland tumors are found more in intact dogs, whereas spaying and neutering were seen in these other tumors. They did see earlier incidences of the tumors, and so kind of my take from it is that if we do have an earlier incidence of the tumor and we have these median survival times that we see with lymphoma, with osteosarcoma, it can lead to shorter lifespans in that direction. So if the tumors occur earlier in life based on altering, based on keeping the dog intact, and we have these initial median survival times, then that's where it's connected in terms of lifespan. Does that make sense?
Maybe.
Yeah, it sounds like the waters are pretty muddy in that arena, but really great questions. And from Dr. Kirk, bringing up the obesity question, and if you're aware, Dr. Meyer, if any of these studies controlled for obesity following the neutering.
I don't believe that there was an increased risk. Obesity, of course, is one of the things that we worry about, but based on my reading, nothing off the top of my head shows that obesity was a primary factor in these.
Perfect. And we'll actually talk about that specific question in the next hour as well. So hold on to that thought. And one other question that I did have for you, Dr. Meyer. So a lot of these studies are talking about the risk of cancer incidence based on whether or not they were spayed or neutered. Do you know if there is any data on the response of these animals to chemotherapy or other oncology kind of therapies based on whether or not they were spayed or neutered? So if they were spayed, they were more likely to have complete remission or so, or something like that.
Not necessarily. A lot of them looked at whether or not these things happen. And because oncology is geared towards a lot of retrospective studies, we can look at, how they responded individually, but there's nothing aimed specifically at, looking at the specific response between intact and altered animals. For the most part, these studies focused a lot on what is the risk of them developing this cancer and not so much of how well they responded.
All right. Well, thank you so much, Dr. Meyer. We continue talking about this for quite a while, but with us moving on, thank you very much. We will now be moving on to surgery and orthopedics with Dr. Katie Adair, who is our second year surgery resident. So, Dr. Adair, are you there and ready to share?
Good morning. How is everyone this morning? It was a really great talk, Dr. Meyer. Thanks so much for that. I'm going to pick it up if I can just share my screen, just a moment. So I'm going to pick it up with orthopedic disease. Can everyone see that, hopefully? So we're going to talk shortly about the effects of spaying and neutering, specifically on orthopedic conditions in dogs. So I'll just kind of preview this by saying that when I'm speaking of kind of timings, I'm not considering any of the other factors that were included in a lot of these studies. So I'm just going to talk about orthopedic disease, okay? So first of all, which joint diseases are affected by the age at which you spay and neuter? So these are the three main orthopedic diseases that we think of. Potentially there are others, but these are the main ones that we have looked at in previous and current studies. So hip dysplasia, cranial cruciate ligament disease, as well as elbow dysplasia. And so while our goal in North America is to reduce stray and unwanted pets by spaying and neutering, we do also have to consider the implications on orthopedic disease such as these ones. All of these conditions ultimately can lead to osteoarthritis and quality of life concerns for pets. And we do have medical and surgical managements for these. However, the best treatment always starts with prevention. So I think it's a great conversation to have if we can be doing something a little bit earlier on to help these animals not have these diseases, or at least hopefully help prevent them. In terms of a mechanism that's suggested to be the cause of the increased risk of joint disease, we think it's related to the disturbance of the closure of the growth plates by the gonadal hormones. So as animals mature, if they remain intact, their long bone growth will close earlier than their neutered counterparts. So this ongoing growth may affect the alignment and angulation of specific joints and bones and set up a predisposition to these joint diseases. So moving on to talk about just a couple studies. So there's lots of studies to look at. I'm going to talk about 3 today. So I'm going to briefly talk about these 2 and then kind of the most recent one in 2020. This first one here done in 2013 looks specifically at golden retrievers. And so it was quite a large study. So it ultimately had, quite large groups, 145 to 178 in different groups, looking at the early neutering associated with hip dysplasia and cranial cruciate disease. So in this study, they did find that early neuterings that was considered less than 12 months was associated with an increased risk of hip dysplasia and cruciate disease. They did find a significant difference as well between early and late neutered males, specifically with the occurrence of hip dysplasia, so before 12 months and after 12 months. And then interestingly, in this case, they found no cases of cranial cruciate disease in intact dogs. Compared to in neutered males and females, they found 5.1 and 7.7% respectively. So it does go to show that, there is potentially risk. I find this a little bit interesting because I think that it's crazy that there was no cases of cruciate tears in intact males. But again, we have to consider how long are we looking at these dogs for? Are we looking at them throughout their whole life, or did we capture them at an earlier time point? In terms of this other study in 2014, this was looking at golden retrievers and Labrador retrievers. So in Labradors, neutering less than 6 months did double the incidence of 1 or more joint disorders. And in Goldens, neutering less than 6 months increased the risk of a joint disorder 4 to 5 times that actually of an intact animal. So just some really good papers to kind of set up the conversation a little bit more. And then the main paper I'm going to talk about or refer to is the most recent paper that I think we all are aware of now. But really, this paper was great in that it set up some guidelines to help suggest the appropriate timing for spaying and neutering for different breeds in respect to both joint disease, neoplasia, and actually urinary incontinence. And so 35 dog breeds were included in this study. And it was really great in that, it looked at a lot of these orthopedic conditions as well as all those other things that we need to consider. So as I said, I'm just going to focus on the joint stuff right now. This looked at hip dysplasia, cranial cruciate disease, as well as elbow dysplasia again. Interestingly enough, also they looked at intervertebral disc disease. And I know that's not orthopedic, but I'm going to briefly mention it here because I don't know if it will get mentioned throughout the rest of the day. But it was also noted whether neutering would impact that status. And so in specifically Dachshunds and Corgis. And so all of the diseases were examined in dogs in specific age groups. So they did try and, account for that. And then the timing of when they were neutered. So less than 6 months, 6 to 11 months, 1 year, or 2 to 8 years. Overall, their finding was that there are specific breed differences and even sex differences, so male or female, on when a dog should be spayed or neutered in relation to that risk of joint disease. So I'm just going to go through a few pictures here on the risks that we're seeing. So specifically in large breed dogs, I know everyone, our thought is that large breed dogs are at predisposed risk regardless. And so I found it interesting in this study that, Great Danes and Irish Wolfhounds, they're kind of that large to giant breed dog, did actually not have an increased risk of joint disease no matter what time they were spayed or neutered. Compared to other large breed dogs, which we'll talk about shortly, had a variable risk. So that could be anywhere from, yes, they were for sure increased risk to no change in the timing of when they were spayed or neutered. Small breed dogs had a vulnerability to joint disorders that were associated with the size of their body size. So small breed dogs tended to have no increased risk depending on when they were spayed or neutered. And you can see all of the breeds listed here. So Boston Terrier, Chihuahua, Shih Tzu, Maltese, and along with those other ones that we consider Cavalier, Dachshunds, Pugs, Corgis, all of those smaller breed dogs did not tend to have an association. Interestingly, so just to go back to that IVD comment, so male corgis neutered before 6 months did have an increased risk of IVDD. So the incidence post, neutering earlier than 6 months was 18%, compared to intact males only had a risk of 3%. So it really did seem like quite a large difference when you neutered male corgis earlier. Interestingly, no significant difference in Dachshunds, so I think unfortunately they are prone either way, no matter when you spay or neuter them. This was a little chart just that I kind of threw together that was looking at the common breeds. So the three main ones I think that we think of with joint disease are going to be golden retrievers, Labradors, and German Shepherds. And so I just made a little chart here looking at male and female, and then the timing, whether they were neutered less than 6 months or left intact, to show you the difference between the incidence of joint disease. And this is all inclusive of any of those three that we talked about: hip dysplasia, cruciate disease, or elbow dysplasia. So you can see in those animals that were neutered less than 6 months that they did, seemingly have quite an increased risk compared to their intact counterparts on increased risk of joint disease. Specifically from this paper, so I wanted to pull out the important pieces for joint disease alone. So this is kind of just some charts showing the recommendations for timing of neuters for specific breeds and specific sexes. So for spaying and neutering, that's recommended after 6 months, meaning that typically we don't want to do less than 6 months in these breeds. It's going to be the Australian cattle dog, a female, male Cocker Spaniels, male Labrador Retrievers, female Rottweilers, and then female St. Bernards. Moving on to look at animals that we should wait until after 11 months or a year, it's going to be male Beagles, female Labradors, male Golden Retrievers, male Miniature Poodles, and male Rottweilers. And then even larger than that, waiting till after 2 years, is going to be male and female German Shepherds, female Dobermans, and then male Bernese Mountain Dogs. And then I, again, pulled this list from that same paper. These are the kind of very comprehensive list, looking at the breeds in which timing of spaying and neutering does not impact joint disease. Thanks, Dr. Ng. Again, just a side note, this does not take into account neoplastic disease. So please also refer to Dr. Meyer when talking about when we should spay and neuter them based on neoplastic disease. But just looking at joint disease, these are the breeds that it doesn't appear to matter when we spay or neuter them. It doesn't appear to increase their risk. And I'm just going to highlight a few breeds here because I thought this was really interesting. So Bernese Mountain Dog females, Boxers male and female, Dobermans male, Golden Retrievers female, Standard Poodles male or female, and then St. Bernards male. So I just pulled out those ones just because, again, I feel like as veterinarians, we tend to think of these large breed dogs as being the poster child for joint disease. And they may be, and not to say that Golden Retrievers that are female aren't going to get joint disease, but just to say that maybe these ones, it doesn't matter as much when we spay or neuter them, but rather we might want to pay more attention to those guidelines when it comes to things like preventing neoplasia or other medical conditions. And then one last point I want to make is just some area where we could do some additional research. So, we talked about how small breed dogs are not in these studies predisposed to joint disease or incidence of joint disease. However, one thing I think we're not looking at is medial patelloluxation. And so that's not really something that I could find much research on anyway. And so I think it's something that maybe could use a little bit of additional research to see, is this something that could be affected by the timing of the spay and neuter? Because at this point, we don't really have a connection, but nor do we have a lot of research looking at that. So that's somewhere we could kind of expand a little bit further. So that's all I have really to chat about today. This, again, is just a summary chart on kind of those breeds, again, and when we should be neutering or spaying them, at least the timing afterwards. So that first category is going to be the breeds and the sexes of dogs that need to wait at least probably until 6 months. The second one is maybe longer than a year. And then that third category is going to be greater than 2 years. Thanks so much, everyone. Is there any questions for me on joint disease today?
Thank you so much, Dr. Adair. That was wonderful and really great, a really great, thorough, complete summary of the findings on joint diseases and spay neuter. Dr. Tobias just commented that there are recommendations about female Goldens, that there's no effect based on time of spay is not consistent with the other papers, and how interesting of a finding that might be. And maybe we'll hear from the Harts afterwards about the differences in those papers as well.
Yeah, yeah,
Really
for sure.
fantastic.
Thank
One
you.
question that I actually have, Dr. Adair, is so you guys will do lots of consultations on gastropexy for these large breed dogs. And so with these recommendations about maybe waiting or being later with spay neuter with these large breed dogs, what are your recommendations as a surgeon based on, like, would you still gastropexy? Because we usually gastropexy at the same time of our spay or neuter. So
Yeah.
separate those out, or what would you tell an owner?
Yeah, I think that's a good question. So I think that this actually might benefit gastropexy because sometimes for those large breed dogs, so I'm thinking Great Danes, if they do get spayed at 6 months, that is really early to do a gastropexy in a Great Dane. So they still have a lot of growing left to do. And if we pexy their stomach and they still grow a lot, that's a lot that can change the anatomy or the positioning of their stomach. So I still would probably recommend doing it at the time of spaying and neutering. And a lot of these larger breed dogs that we're recommending to do it later, it might actually be beneficial to do it at that same time when we wait a little bit as well, because then they're full grown. We don't necessarily have to worry about them growing out of where we pexied our site, if that makes sense.
Yeah, that is great. Thank you very much for that insight. Much appreciated. Thank you very much, Dr. Adair. All right, so moving on, we will now take a turn into internal medicine. So taking a look at all of those, basically urinary incontinence was the main focus of this. And here we have our queen of urinary continence, Dr. India Lane, who is not only our internal medicine specialist, but also our Associate Dean of Students. So thank you so much, Dr. Lane, for being here. And I'll let you take it from here.
Yeah, you always have to be careful what you get known for, and what you want to be queen for. But thanks. Let me find this PowerPoint.
Queen of the dribble, I think.
Queen of dribble. Yeah, that works for me. All right. And hold on a second. Somehow I was thinking there was someone else ahead of me yet, but and I'm going to give a little bit of a different view here, at least in terms of the presentation, just share a little bit of historical information, as is privileged for my age and seniority, I guess. And then share some of the recent papers, which will have a very similar theme to what you've heard already. And obviously, urethral sphincter mechanism incontinence, or urethral incontinence, which is the easier way for me to say it, is something that's been associated with spaying for a long time. And there's always been quite a number of questions about exactly what the pathophysiology would be. I don't know that we can still share exactly what it is, but there's probably some combination of factors, including something related to a change in their hormone levels, either the estrogen perhaps at the tissue level, or the chronic elevations in FSH and LH that happen after we have an animal spayed. The only things that we see kind of more recently are that we do see things that are similar to postmenopausal women in terms of a change in the proportion of collagen to smooth muscle. And that's consistent with the chronic hormonal changes. Now, the association with spaying and the prevalence or the degree of risk has always been a little bit of a controversy as well in terms of how common it really is. And some of the European studies, especially out of Switzerland, some other areas there where they have done a lot of work, and in Britain over the last 20 or 30 years, suggested that this was quite common, and that up to 20% of dogs that were spayed would develop urethral incontinence. And certainly that was always a bit higher than what we could see in any retrospective studies in North America, which suggested a bit more of about a 5% prevalence. And in 2013, FORSI did a larger retrospective than kind of what we'd seen before, and again came up with that roughly 5% of prevalence in spayed dogs. And the typical age was about 3 years. It usually develops within 2 or 3 years following their ovarian hysterectomy. And in this particular group of 550 something dogs, there really was no apparent association with the age of spay or timing of spay. But that's looking in kind of a large group. And the one thing that certainly did start to shake out by this time was the relationship, though, with size. And so certainly the dog size and breed, again, body weight made a difference in their prevalence and odds ratio for developing incontinence after spay. So here you still have that roughly overall 5%, but when you look at a little Chihuahua, it's quite low. When you look at a big Labrador or a dog over about 25 kilos, the prevalence is a bit closer to 9 in that particular group. So here's where, just like with these studies you've heard before, we start thinking about large breed dogs and being at higher risk with ovariohysterectomy. One more a little bit more recent study out of England looked at 100,000 dogs admitted over about 4 years and found about 3%. And even in that particular group of dogs, even though 3% had something noted at admission about urinary incontinence, only about half of those 3% actually got any treatment for their urinary incontinence. So a lot of it was fairly minor, apparently. And again, the odds ratio went up with certain breeds, with overweight dogs, and with neutering in general. The next thing that started to, or at the same time, I guess I should say, the main question about timing related to urinary incontinence after spaying was, do we do it before the heat cycle or after the heat cycle? A little bit different from just looking at age alone. That first question was always, well, should we let the dog go through a heat cycle and mature a little bit more in terms of genitalia and maybe bladder and urethral and vaginal maturity and so forth? So this was the first question that folks started trying to answer. And of course, dogs will have their first heat cycle at different ages. Peter Holt, back in the day, would always say that even dogs that had incontinence before, when they were quite young, he would say wait until their first heat cycle and it would get better if you did that. And that really wasn't my experience, but this was kind of the question that we were first dealing with. And there were some conflicting studies that didn't necessarily look super convincing, that even showed that spaying before the first heat might be protective as opposed to after the first heat. But a study from a case control study did look at spaying before the first season and found that there was no significant difference in that particular case control study. We do see the risk will increase for dogs that are, the next question became, what about the really early spay in shelter medicine? And we did have pretty good evidence that the risk increases for dogs spayed at less than 3 months. And we kind of held on to that notion for a little while, again, coming from the questions about really early age gonadectomy. In this particular study, Spain study, they looked at the hazard ratio, and I'm going to show you 2 studies now that looked at hazard ratio, which is exactly what these studies have been talking about in terms of if you can, for every month that you can delay, or for every month that you go earlier for an ovariohysterectomy, the risk changes. And with Spain's study, there was a pretty clear indication that the hazard ratio goes up at the earlier the spay is under that 5.5 or 6 month age period. So in saying that a different way, for every month younger than 6 months, the risk goes up. Julie Byron then looked at kind of the opposite end, where we're looking at what happens if you can delay spaying in dogs. And she looked at the hazard ratio based on body weight, including body weight in the analysis here, and had 100 and so dogs, 160 or 170 dogs, and discovered that the 30 seconds, Zinni, I just started. That the longer that you can, decrease in the hazard was found in large dogs for every month of that you can delay the neuter within that first year. So the hazard ratio was dramatically impacted by delaying neutering for large dogs, dogs over 25 kilograms. It's kind of a gray zone between 15 and 25 kilograms. Doesn't matter so much for smaller dogs. Now, very briefly, breed differences are the next thing that we're talking about now. And the breeds that are challenging for us tend to change depending on where you are and kind of who you're working with. But we certainly see some of the same breeds coming up from the previous conversations about orthopedic disease and the hearts study and other studies. Doberman pinschers absolutely are worst poster children for urinary incontinence and for control of that incontinence. Springer Spaniels, Rottweilers have kind of always been on my list. It was interesting to me to see Shelties and Collies and Westies. I guess we just don't see that many Collies, and I don't seem to see that many Shelties with incontinence or Westies, but those are the notes from the incontinence side, which really do parallel with much of the orthopedic information and tumor information, except for perhaps Westies.
Excellent. Thank you very much, Dr. Lane. That was wonderful. I didn't realize that all those other additional studies that really looked at those effects, because it really does seem that urinary, that spay incontinence, what we call, is one of the biggest sort of quality of life factors that really impacts owners. And I still remember to this day that my cousins, even after being a veterinarian, they always said that they would never spay their dog again because they had a dog who spay incontinence, and that they were so traumatized by that. With that being said, I think that it's interesting that you brought up the odds ratio based on those papers. And outside of like being a breed predisposition, like Irish Setter, Doberman, or being overweight, older age, or neutering at an earlier age, what do you think is the top factor that's really going to increase the risk of them having spay incontinence? Well,
I think kind of based on all of this, I think it's still size and breed. And the I don't know that I can make a whole lot of additional comments than that. It's because it's now, and you know, I guess I didn't show the slide that said what does the internal medicine service recommend, and we tend to look at a combination of their genital maturity, their vulvar conformation, their breed, age, size, before talking about spaying. Fortunately, we don't talk about spaying a whole lot in internal medicine. They're either already spayed or not. But I think the biggest thing is still breed and size. I don't think we have any real good data on how much conformation plays a role in it.
Excellent. Well, thank you so much, Dr. Lane. We really appreciate your time and being with us today and providing your expertise. All right, so we are moving on to our last presentation in this series. So that is going to the shelter medicine group. So we have the esteemed Dr. Jennifer Wysant, who will be giving her perspective. So thank you for being with us this morning, Dr. Wysant.
Thank you, Dr. Ng. It's really been nice to hear the previous presentations. I think most of you have actually mentioned the shelter side at one point or another as a perspective, despite the fact that you're, kind of immersed in a lot of peer review and important data that are making these important correlations. So I'm going to kind of reshift the entire focus here, and let me pull up my screen. Okay. All right. Shelter veterinarian perspectives. I wanted, before I kind of go into some of the numbers, just share with you what shelter veterinarians are thinking about. And I'm getting this from the groups that I'm in, the forums that I see, the people that I talk to. Shelter veterinarians in general really care about this topic. It's not something that they take lightly. They are doing their homework. They're checking out the CEs on it. They're engaged in trying to understand the research, because the reality is that the shelter veterinarians do not want to do harm. And we know that we are the perpetrators of pediatric and early age spay neuter. I mean, we are the factories of this practice. So it's an important topic to us. Secondly, we do recognize that this disrupting complex factors that involve hormone regulation have effects. We know that there are positive and negative effects, and we as herd health experts have to think about that, but we also have to zoom out and try to understand which effects are going to be more important for us in our field. The last thing that comes up when you get some shelter veterinarians together and we talk about the papers that are out there, is that statistics are really hard. There can be a lot of confusion around what many of the studies are saying and how they're saying them. From my perspective, statistics are hard, and I have a PhD level minor in statistics and a degree in epidemiological modeling. Okay, and I still have trouble kind of parsing out some of the statistical pieces that happen in these studies. So what shelter veterinarians want to say on that is basically that we're hesitant to base our actions, advice, or policies on a limited number of studies, number one. Also retrospective studies that don't have true control. So they're not coming from that fundamental a priori control setting. They are typically on biased populations. So we're coming from, tertiary referral centers, et cetera. And then a lot of the data end up looking like correlations and not necessarily causation. So although correlations are really interesting and we should follow that line and try to understand them more deeply, to make a causative link there is a bit of a push. And then also what we notice is that a lot of the papers are kind of maybe trying to make an inference on the broader population. And, if you look at what I'm saying here is basically the epidemiologist's nightmare when it comes to studies. These limited studies, retrospective, biased population, correlation, and then inference. So I think that, despite the importance of all these journal articles, we need to keep searching. All right, so some background, some numbers, and what are those implications? There are 64 million pet dogs in the US. Dogs are in 50% of households, half and half, pure breed and mixed breeds, right? About 90% of those are fixed already at some point in their lives. So, maybe 10% of that 64 million dog population are intact. 19 million pets have been estimated to be living in underserved communities. So these are folks that are probably not going to spay or neuter their pet, somewhere around 85, 90% of those. And then 70% of them are never going to see a vet in their lives. And this is something that we mention in our rotation. We get a handful of shelter animals and the students are examining them and we say, hey guys, you might be it. You might be what they see for their life. So do the exam of your life on this animal. And then, somewhere around 50% of litters are unplanned. So if you look at the numbers, this is high numbers here of potential for overpopulation and for unwanted animals. Another thing, there are some 3,500 shelters in the US, and so 10,000 or so rescue groups. So if you're looking at 13,000 facilities that have information on spay, neuter, and on overpopulation and on neglect and abuse, et cetera, it's just kind of a small number, but it lands up having with 6 million animals going into shelters annually, and somewhere around half of those are dogs. Of that half population of dogs, 670,000 of them are euthanized, and the majority of those are healthy or treatable. So as you can tell, I'm kind of building my case not for discounting important information about, what the potential for spay neuter in life is on an animal, but I'm, trying to highlight the fact that some 10 to 50% of sheltered dogs are euthanized. So how can we prevent this? And then also, there's a huge unknown here. How many animals are not counted? I know people who will shoot a dog. I know people who would drown them. And that is our history, speaking to Dr. Lane's historical perspective, that is the historical perspective in shelter medicine. We club, we shoot, and we drown in order to take care of populations of animals that are unwanted. Okay, I'm going to just throw out some other issues of note, and these aren't in any, particular order, but in the sheltering world, if you don't, there's this thing called NBA, neuter before adoption. So most shelters are reliant upon certain funds, and within their policies, they oftentimes have a clause that says, if you walk out the door without being neutered, you will not get funded. So there's a hard time there in looking at an animal that might, let's say you have a puppy, a litter of Goldens, and you need to get him out the door. And in order to get him out the door, you have to spay and neuter him. They're 8 weeks old. I mean, what's going to happen in the shelters? They're going to get fixed. So holding on to them not only would increase the stress on the shelter system, it increases the suffering of the animal having to be in an environment where it's susceptible to many diseases and behavioral issues, et cetera. But it also is compromising, if we don't get it out the door, it's compromising the shelter itself. So that is a big challenge. Furthermore, I think there's a challenge that goes across the board between clients, between their veterinarians in determining who's a responsible pet owner. So are you willing to take the risk when you are counseling your client as to whether or not they should spay or neuter their pet, that in fact they won't spay or neuter them, or they will, at some point get pregnant? So, Dr. DeBolt tells this story of, this very responsible pet owner, and they were going to wait on the spay, And then the dog goes in heat and, it gets out into the backyard and somehow ties through a chain link fence. So these, the female dogs, when they go into heat, they want to get out. And a lot of owners don't really understand the level of responsibility they have to take for that. Another point is that when it comes to surgery, the older you get, the larger you are, the more complicated the surgery is, the higher the complication rate, the higher the cost. And cost is quite a deterrent for many. We know this. So it's just another piece to consider when you're making your recommendation. Another thing that I note is that there's a significant portion of female canines that land up in the shelter that are, somewhere over 2 or 3 years old. They have already had a litter. They come in the door in the shelter, they've had a litter. You haven't seen the litter, you don't know where it is. But is there, if they had been fixed already, would they even have arrived in the shelter? So there are just a lot of other kind of fuzzy factors there that add to the overpopulation situation that are related to the fact of animals not being fixed. And on the medical standpoint, sterilized animals live a lot longer. We've got plenty of data for that. And they are less susceptible to some other diseases and conditions. So it's important to, I think, weigh those benefits to the detractors that we've seen today. All right, the quick lowdown is in shelter medicine, you're gonna spay prior to walking out the door, and up to 6 weeks of age is fine. We can typically spay and neuter. Let's go for spay. We can spay an 8-week-old puppy in 7 minutes. That puppy through a centimeter incision. That puppy gets up off the table and has breakfast an hour later and walks out the door. So what you're looking at is a pretty uncomplicated situation with these young animals in terms of their surgical, the ease of getting them done and out and safely so. Now, Dr. Bushby, who is renowned in the animal welfare world as well, he's a boarded surgeon. He also recommends, other than the top point there, that owned cats and owned female dogs are spayed prior to 5 months of age. Owned large breed male dogs, they're giving a little bit more leeway on that, 15 to 18 months due to orthopedic concerns. And then, in general, specific breed related concerns, I think, what you want to do is know that the relationship that the client and the veterinarian have is one of trust, where the choice that's being made is actually going to happen as it's planned. In other words, if you're waiting, you wait, and then you get it done. I have one more quick perspective, and I know I've got 30 seconds. So what I'm going to do is just read, I'm going to read to you 2 quotes that I have. I've read a recent article. It's called Transforming the Academy. So the urgency of recommitting higher education to the public good. How can we somehow weave the information that we have as disciplines such that we complement each other and help each other? And here are the quotes. The expansion of what counts as knowledge and productive scholarship also requires a genuine mindset shift, as we need to pay as much attention to questions of importance, such as this, that emanate from outside in, as those seen internally critical by our disciplines. And so, with that, accordingly, we would all do well today in this divisive national and global moment to pause and think deeply about what the public needs us urgently and patiently to study, and to teach that to the next generation. So I guess my point being that while, in our rotation, the shelter medicine rotation, we, Dr. DeBolt and I, we take this issue and we say, yes, you guys, there are lots of details and there are studies, but you're still going to have to make a decision that makes sense for your client. You're going to have to make a decision that makes sense for the populations that you're around and in. And so taking into account, all of the factors is it's really important to us. And I think to us as a university. So thank you.
Wonderful point to end on, Dr. Wyson. Thank you very much.
Thanks.
The exact point of these interdisciplinary rounds is to have a different perspective on each of these issues that we are going to encounter. With that being said, there are some questions, but we'll actually be using that as a platform in the next hour because I know that there's so much to talk about and unpack here. So Dr. Bison, we'll come back to this question about the hormone spaying sterilization. And so hopefully in this next hour, we will do that. But let's give everybody like a 1 minute break. And then we will keep us kind of on time. I know that was a very exciting hour that we just had. So thank you to all of our presenters for providing that insight and all of that data. So we'll use that information to kind of have our conversations in this next hour, which we are so delighted to be able to share. So we are so fortunate and so lucky to have Dr. Ben and Lynette Hart join us this morning from UC Davis. So they have been so gracious to provide their time with us from this very important work that they have done, and to be with us on California time. So this is our chance to have conversations with them and go from there as far as where we at the UT kind of stand as a consensus on the spay-neuter issue. So to introduce Dr. Ben and Lynette Hart, hello. Dr. Benjamin Hart is a distinguished professor emeritus of the UC Davis School of Veterinary Medicine. After arriving at UC Davis, he developed the very first comprehensive teaching and research program in veterinary behavior, which he led until his retirement. He's still very active in research and writing on cats and dogs, adding yearly to his current list of over 200 publications, most of which are available through his site on ResearchGate. Dr. Hart was the lead investigator on a 10-year project examining joint disorders and some cancers that may now be associated with the age of spay-neuter in several breeds of dogs, a project which is now published along with another study on joint disorders and cancers associated with the age of neutering in certain weight classes of mixed breed dogs. He's a fellow of the Animal Behavior Society, a fellow of the International Society of Anthrozoology, and a founding diplomat of the American College of Veterinary Behaviorists. So thank you, Dr. Hart. And we also have Dr. Lynette Hart, who is in the same camera. Hello, Lynette. Lynette Hart is a professor of human-animal interactions and animal behavior at the UC Davis School of Veterinary Medicine, where she teaches courses and leads research and mentors students on human-animal interactions and animal behavior. She completed a PhD at Rutgers University, go Rutgers, in animal behavior, and after arriving at UC Davis, spearheaded data-based studies in the newly developing field of anthrozoology, publishing well over 100 papers. From the early 1980s, this work has particularly focused on service dogs, optimizing people's relationships with cats or dogs, and pet loss. She's a founding member of and fellow of the International Society for Anthrozoology, and was selected as the first distinguished anthrozoologist in 2017. The special relationships of pets and with assistants and service dogs are a current research focus, as well as behavioral studies of elephants. So thank you so much, Dr. Ben and Drs. Ben and Lynette Hart, for joining us this morning. We're so pleased to have you and to see you both be well. And I'm proud to call these individuals my mentors, colleagues, and friends. So thank you very much for joining us. Excellent. Yeah. So this morning, yeah, I think that if you have a presentation, I think we're going to start off with a short presentation and then Q&A right after that. So if you have your share screen option. Then...
Well, this is just going to very briefly cover a lot of what's already been said, but just gives you the context again. And we got the term paradigm there because what we're doing is the overriding emphasis is increase the discussion between the pet owner and the veterinarian and do it at an early age. You know, the veterinarian establishes a relationship with the client early because that's the question of spay and neuter is going to come up, and establishes a relationship, and then they talk about the kind of breed and the data and to when they can bring their dog or cat in or the dog male or female in for spay neuter. So that's what we were suggesting, rather than well, 6 months, you're going to be 6 months in a couple of weeks bringing the animal in just automatically for spay neuter. So we launched this project in 2010, and been going on. We just wrapped it up. We used our hospital database, and it is retrospective data. We have probably the largest caseload in the country here, and we wanted to analyze several breeds. So we got up to 35, including the 3 varieties of poodle. And with our own data, with our own hospital record, we could apply strict diagnostic criteria. So everything is the same. And we could analyze several parameters as opposed to let's say getting a collaboration with about 10 veterinary hospitals or something, because things are going to vary a little bit from one to the other. So it's important that we try to get things as consistent as we could. Okay, there, okay. The parameters that we wanted to look at, so each of these breeds, we looked at the joint disorders, you see those displayed there, and the cancers, and those are up there. And we looked at ages of neutering, because that's important. And by the way, this work was sponsored by the Canine Health Foundation and the of AKC. And one of the first questions they asked me when we were negotiating the funding for this is, well, you're going to have the age of neutering, aren't you? Because there wasn't that many cases in our record that had the age of neutering, so we had to call the referring hospital, the owner, and get that age of neutering. Anyway, we looked at, these are the ages we looked at, and then we compared with the intact dogs of that breed. That's the best one. And we thought we'd look at a major parameter is the one or more joint disorders, although we give data on the individual ones, at least one or more of the cancers. And we look separately at mammary cancer, pyometra. Okay, just to give you an example here. Golden retriever, these are joint disorders. And you can see here, both males and females are vulnerable to increase in joint disorders with the 6 months spay neuter, especially that one. And then they get out of the woods there pretty quickly with the by waiting. With so these are just comments about the golden, and it's one of the most vulnerable breeds. Morris Animal Foundation just came out recently with their prospective study published in PLS One, and we were interested in seeing that they when they looked at cranial cruciate disorders, they really corroborated basically the same thing we found in our study. So it's a completely independent prospective study that's reflecting roughly the same thing as we found. Obesity. We have in our earlier papers body condition score, and so we track that, and that is a weak association. Okay, so what I want to point out here, here's a breed, a larger breed, boxer, and no increase in joint disorders, and that breed with a spay or neuter. Okay, the small breed dogs, and you can see there, neutered less than 1 year, no really increase in joint disorders in the small breed. Okay, and a mixed breed even. We got here dogs that are over 20 kilo, 43 pounds or something, and one or more joint disorders there. You can see here at 6 months and 6 to 11 months for the females here. By the way, I should have emphasized that the horizontal line is for the intact, and the bullets there are for individual ages. So you can see here, if you get a mid-sprig dog, it's important to pay attention to the age of the spay neuter. And cancers, the golden's probably the most vulnerable to the cancers. The female here, the intact female, you can see it has a fairly low intact rate of cancers. And then you go with a spaying at almost any time, you can go up to 3 times that with spaying at any time. All right. And so that's something to keep in mind. And boxers here are suffering from increasing cancers with neutering. Even beyond that, look at 1 year. Yeah, after 12 months, even it goes way up for the females and the male compared with their intact levels. Okay, trying to get this to move on here. Oh, there we go. Okay, the small dogs, the small breed dogs, no effective cancers, except the Shih Tzu, which the female Shih Tzu has an increase in cancers neutered at 1 year, and it really stands out as different. Okay, so when advising clients, consider the living situation, care of the client's expectations, and assist the client in decision making. So we're going on to the next year, and Lynette's going to take over.
So I just quickly talk about service dogs, because many of those are the large breeds that are particularly affected. They typically may require extended training, perhaps up to 2 years, and a lot of investment prior to being placed with handlers. And then their partnership often is curtailed before the dog's life ends. So if they're handlers, they face short working lives with their dogs and painful separations, and that happens frequently. So finding ways to extend the working partnership is important. This slide is from California. There's no really any kind of surveillance on service dogs, but through freedom of information, we could get data on 7,000 dogs. And you'll see that Labs, Goldens, and German Shepherds were primary large breeds. This is a graph that shows you all the different outcomes that happen with service dogs. They may be retired early because they're getting old, and the person might then keep the animal as a pet and later get another dog. Some of them have sudden death and retire that way. Sometimes they have a medical or behavioral issue and might be adopted by a relative. And one of the most painful things is when they have to be retired and they're adopted by an unknown family who doesn't keep them informed. So they worry about that. So these working dogs, especially some of the larger breeds that are very affected by early neutering, require this extra extensive training. And we would like to find ways to avoid increasing their risks of joint disorders and cancers by simply delaying neutering, which would extend their working lives. And that is final slide.
We made the timing.
Excellent. Thank you both for sharing that. And thank you, Dr. Lynette Hart, for especially your importance on work with the service dogs, because obviously that speaks to my own heart. But thank you both for your 10 years of just like of unfailing work with this and for providing these recommendations. So now what we're going to do is that we are going to take this in turn, because obviously we can all access your papers and and find out all of the important information to share. So this is really our chance to speak with you, both of you personally, to kind of find out, dig a little bit deeper into these papers and the data that is there. So we do have some people who do have some questions. We received quite a few questions, and I wanted to share if Dr. Tobias is around with us at this moment in time. Dr. Tobias is our guru in soft tissue surgery, and she lectures on age of spay neuter and complications of spay neuter and things like that. So Dr. Tobias, we were wondering if you had a couple of words to share, and I know that you had also asked that question about von Willebrand's disease and spaying and neutering those dogs.
Yeah, I think that this is a really great topic for us to be delving into, and I do get concerned about how we evaluate the statistics, like Dr. Wysant said. I think that's all very, very important. And one of the things that has come up with this is, first of all, I do change what I teach to the students in theriogenology because I think the information is important. Second of all, I think it's important to bring up the adoption rates. There have been some papers on shelter medicine that have shown that if the animals are neutered before they're put up for adoption, that the adoption rates are increased. And so we have to balance the fact that animals could be euthanized if they don't get homes versus the fact that there could be some effects of being spayed or castrated early. So I think that's a really important thing. Every time that we consider this, we have to think about the situation of the animal and the situation of the owners. I personally can't imagine having a St. Bernard or a Great Dane who's in heat, or a male intact Great Dane around a neighbor's dog who's in heat. How do you restrain something like that? And in the last 18 months, I believe, we've had at least 3 dogs come in that were large breed dogs that came in for hemoabdomens because the veterinarians tried to do the spays through a small incision, just like they would do if the dog was a 4-month-old or a 5-month-old. And these giant breed dogs, the approach is going to have to be different if we're doing spays and neuters at that time. So I do think it's going to be hard for us to come up with a consensus statement because I think it has to be based on the animal and the situation and the owner. I think it's going to be really important, however, for us to have this information out there so people understand that if you spay or neuter at a very young age, there is a possibility that there could be health effects that might affect the quality of the life of the animal for a long period of time.
That's great. Thank you very much for those points, Dr. Tobias. With that, any comments, any additional comments on the surgical perspective?
I can make a comment on that if, can I add something? Right. Thanks, Dr. Tobias, for mentioning that perspective as well. Dr. Hart, when you spoke about that client relationship, that piece feels very important to making these recommendations. And one thing that makes me a little nervous about the general information in terms of what the public is going to understand about this topic is that there will be, I think if it continues with like unchecked, an understanding of the topic for the general public is going to be something like, don't get that spayed or neutered animal that was young, spayed or neutered animal, young spayed or neutered animal, sorry, stumbling on my words, but because they may have issues in the future. So I just can foresee like the public taking this out of context and sensing that the animal that they pick up from the shelter because it was spayed or neutered at 8 weeks is on track for having all these horrible problems. I just think that the public will, if we make too heavy a statement on this topic, that it will be construed in a difficult way that will make things in the shelter world even harder than they are. So I worry about that piece.
Yeah, that's a very important perspective, Dr. Wyson. So thank you. And actually, that brings up a question, Dr. Hartz. If you would be able to comment on what your recommendations or counseling with owners who have had adopted dogs from shelters who were spayed before 6 months, and let's say it's a female golden retriever or male Doberman that says absolutely don't spay or neuter them. What do you tell owners about kind of monitoring for health long term with their veterinarians down the line?
Well, it's just got in regard to female golden retrievers, you've got to be vigilant of the cancers. And
But he's talking about a golden female that was already neutered.
yeah, I know, already
Yeah.
neutered.
Yeah.
So they're the ones that could come up with these different cancers. So you have to
Mhm.
monitor
Right.
the cancers and keep keep aware of it, because you've got about 3 or 4 times the risk of a cancer in the female golden. With the male, it doesn't make any difference because they have a high rate already, 11%, and it doesn't really go up with neutering. So, if it's a male or female, it makes a difference. And I've been asked this question: is there any kind of hormone replacement therapy? And I don't know of anything that's got any control to it, or any, you know, anything that substantiates the value of hormone replacement for the animal's lifetime, if you will. So, with regard to shelters, and this comes up all the time, came up when we published our first paper in 2013, and they with the shelters. What are you going to do? Flood the shelters with unwanted puppies? Well, we have learned since then that there is a shortage of dogs in shelters for adoption. Maybe not in the southern states, but certainly in the country in general, there's a shortage of dogs. And in fact, this country, our country, U.S., imports 1 million dogs into shelters to be adopted out. And they come from Asia. And so we're getting, because there's just not enough brought into the shelters to be put up for adoption. So we certainly agree about decreasing the euthanasia, and that has gone down. And in fact, relinquishment to shelters has gone down because of the excellent job the shelters are doing on their education of the public. But I think putting things in balance, I don't think it sells the argument that we're going to be contributing to the overpopulation. I mean, certainly only the responsible owners ought to be involved in these conversations with the veterinarian about the correct or the best age for spay or neuter. Lynette, what have you got to say?
No, I think you covered it. Yeah.
So that's kind of my thoughts on the matter here. Is when we first published that golden retriever paper, it was kind of misunderstood by the public and the veterinary profession in general that we were arguing against any spay or neuter, and it wasn't. It was just delay it. And again, when do you delay it for? Well, if the golden retriever, delay past the joint disorder thing. With the female, I consider the increase in cancer and be careful in monitoring it. One final question or comment here on the shelters. I've yet to see any shelter talk about vasectomy in males, and to show that the person could, that they're not going to reproduce, and they could go and have the dog castrated at a later time, no problem. Tubal ligation could work with endoscopic equipment for females if you just want to make them sterile, and leave it up to the owner. I mean, it's not in the dialogue really. So that's about as much time as I'll use on that one.
Yeah, thank you very much. Yeah, opening up that Pandora's box about this issue. So with shelter medicine, and thank you for addressing that. And number one, kind of one of the concerns or one of the things that I really came out with from these recommendations is that if you do have, like, let's say that you adopt a female golden retriever that from a shelter that has been spayed, it's just about counseling those owners and like kind of towards the maybe middle to middle aged females when they reach that age, maybe for your primary care veterinarian to kind of perform more vigilant screening. So maybe doing more thoracic radiographs, ultrasound, kind of on a more regular basis than we might have done previously. So thank you for that. And so kind of going to the shelter.
You might add one point. There aren't that many purebred dogs available from shelters. They're mostly from rescue groups, as far as I know. If it's a small dog, then there's no problem. You know, so maybe there ought to be a differentiation between spay neuter of the really small ones, but it's, you know, they're going to be mixed breed, a Chihuahua mix, a lot of Chihuahuas, you know, and see what that, see if they can kind of do some parceling out their practices. That's the only thing. Give some thought to that.
That's
okay.
Great. Thank you. And so with this whole, with our shelter medicine sort of issues, and so Dr. Wyson gave a wonderful presentation just a couple of minutes ago, and Dr. Wyson was wondering if you had any points to add, especially about vasectomies, and we're actually going to hear about a little bit about the ovary sparing spay in just a second as well, but wanted your thoughts first, Dr. Wyson.
Yeah, sure. I have to speak to what's going on in our region. We don't have enough vets in this region to do the spay and neuter in the first place. We are not in the situation of the Northeast where they have to transport dogs in. We still have tons of dogs that need to get out. We're just not in the same place as some other regions in the country where they can consider these options. In fact, to throw out an example, yesterday I was speaking with one of the activists who drops off some animals for us in the Jeff County area. So that's a bit north of us. And we got on the topic of thinking, how can we lure some spay neuter vets down here or in here or out, you know, from our coffers of students that we train to work in this region. The Jefferson County, Hamilton County, Washington County, every county that I know of that I speak with the directors of needs somebody to do this work. And so the question of vasectomies, the question of age isn't even on the table here. So that's what we got.
Can you comment on that, Dr. Wyson, about because I've heard this statistic about the US importing so many dogs from all these other countries, from the islands, from China, from wherever else it might be. And we were wondering, like, kind of what is the status of that? If we have such a pet overpopulation here in the Southeast, why are not all those dogs being farmed out all over the country so we don't need to import more dogs in here?
I really can't speak to that. Can someone else, Dr. DeWalt, can you speak to that?
Yeah, I'm happy to talk to it a little bit. I think it becomes, what I've seen being in the field for a while is that it depends on the region, and a lot of it is the bleeding hearts and sort of personal projects that people develop. And if you travel to third world countries, you see that they have a huge overpopulation problem, a ton of strays running the roads. And so even compared to Knoxville, and I hope y'all can hear me still through my mask, I apologize. Even when I go to, say, Central America area, our situation here is probably 1,000 times better and more controlled than down in Belize. So I think some of that becomes a perspective. And that's been my experience in most other parts of the world, most other continents. So, so from what I've seen, it's become people who just get focused on one project. And I did want to touch a minute on the vasectomy idea. I'm not opposed to considering that in the shelter world as we go forward and thinking about the pros and cons of that. There are obviously a few cons. We know that vasectomies don't always work. I also had an image of having hormonally intact animals in a shelter and having a bunch of in-heat females and a bunch of vasectomized males, and how difficult that would be to manage. The goal would be to not have any of them in the shelter. So I should start by that. But recognizing that we're still in this position where our shelters are full. And speaking to Dr. Hart, there are definitely different regions of the country are very, very different. And different parts of the world, that's even a bigger difference. So in one area, and we see it just in our counties around here, one county may have still a large population of puppies coming in, but other counties have that under better control. So I don't feel like we're at a point where we can say, hey, we have this part under control. We can really shift our viewpoint, or we can shift our focus yet. And there was another point I was gonna make, and now it's trying to go away. But I'll come back to it.
Thank you, Dr. DeVault. Much appreciated. And on that point, and this was brought up before about hormone-sparing sterilization, and was really interested on everybody's thoughts on this. But I wanted to see if our future Dr. Sarah Staley was on the line and available, because I think that she had some wonderful personal insights about this with her personal dog.
Hi, can everybody hear me?
Yes, thank you.
Okay. So I guess I'll just tell you a little bit about me and my dog. So about 3 years ago, I decided to go to a reputable breeder who health tested and did, orthopedic, testing on all of their dogs. And when I brought her home, I immediately started thinking, okay, the big question, I'm going to vaccinate, I'm going to do all the things that you're supposed to do, but when do I spay and neuter? And there seemed to be 1,000 different things from 1,000 different people telling you different ages. And this was around when this was my first year of vet school. And so I hadn't really had any of the classes. So I started having to do the research myself. And I looked at a lot of the papers that actually were talked about today, from cranial cruciate tears, osteoarthritis, different forms of cancer, and and the urinary incontinence. They all kind of started blending together, and I was like, do I do it at 6 months, like my veterinarian says? Do I wait until her growth plates have closed? Yes.
Sorry to interrupt. What breed of dog?
She is a standard rat terrier, so she weighs about 25 pounds, so small-ish, about beagle-sized.
Thank you.
And so obviously not the same risk that like golden retrievers have, but I was still concerned. It's easy to kind of give your recommendation to other pet owners, but when you kind of can look objectively at yourself and say, okay, I have no other intact dogs in my home. I know that I can keep her contained, and I know that I can, walk her and keep her in my yard responsibly. I know that I can ensure that no litters are produced because, I know myself. But obviously there's the risk of intact dogs with pyometra and, mammary tumors. So it was kind of a blending together. And finally, I kind of stumbled on this kind of middle ground, I guess you could call it, of ovarian sparing spays. And essentially, it's very similar to a traditional spay procedure. Instead of ligating at the suspensory ligament, you ligate at the proper ligament, making sure to leave the ovary kind of minimal tissue handling as possible, and avoiding ligation of the ovarian artery. And then you make the incision a little bit kind of more cranial and more caudal, so the incision is a little bit bigger. And then you go down and you make sure that you remove all of the uterus and you actually ligate at the cervix. So the benefit of this procedure is that it does eliminate the risk of pyometra. It also eliminates the risk of any kind of reproduction that will occur, obviously with no uterus. There are no puppies. It also allows her to keep her growth hormones, which kind of has some pros and cons. The pro is she has a low risk of developing any kind of urinary incontinence. She has a low risk of developing many of the cancers that are increased with, spaying and neutering, which I know there were multiple studies about, and I'll kind of leave that. And then obviously a decreased risk of joint disorders like cranial cruciate tear, osteoarthritis, and elbow disorders. And considering I wanted to keep her as a sport dog, so we do multiple sports, including agility, obedience, rally, dock diving, fast cat, and barn hunt. So it was really important to me to make sure that I keep a healthy, happy dog that is, physically sound for as long as possible, especially because she is at an increased risk with this increased kind of activity compared to the, normal pet. So the one difference and the one kind of con I will say is she does, because she still has her ovaries, she does go into a heat cycle. It is similar to a silent heat. There can be a little bit of like clear discharge, but honestly, it's very short. It's maybe 1 or 2 days. There's no blood because, again, there's no uterus, and I just keep some like dog panties on her, and it's no issue. But that is something to keep in consideration if you, have an animal that is, intact, and you have multiple, other males. They will be interested in her. So that's something to keep in consideration. But I guess in frame of a question, to Dr. Hart, do you consider this to be a, feasible alternative to, a lot of people who, sorry, I got distracted by a question, but do you consider this to be, a feasible alternative to people who maybe want the benefits of an intact dog, but are concerned about things like pyometra? And are you familiar with this kind of procedure, and have you had patients who have had it done?
It's an excellent comment and question. And yeah, I think it's a really ideal solution to the problem. And we haven't had any, I might say clients or pet owners who've had this procedure done, but I think it makes a lot of sense. And you still have to deal with mammary cancer. And I'll just place to put in a side comment here. There's a paper that came out in 2012 that we overlooked citing. And it came out from Sweden, where most of the dogs are intact there. Sweden, they spay very few. And they have a rundown of a large number of breeds and the incidence of mammary cancer and their ranking among all the other breeds. So you can actually look at the breed of your dog and look up that paper and then see the risk of mammary cancer. And that might be something that could be taken into account. Certainly you want to keep palpating the mammary area so you are vigilant about mammary cancer. So just because you avoid pyometra doesn't mean you're avoiding mammary cancer.
Part of part of my plan for my dog is once she turns 6 years old, yearly radiographs to check for mineralization and weekly palpations to make sure that there's no tumor developing. But that is something that I did take into consideration, just because, that does remain an issue.
Yeah, right. No, excellent idea. I think it's really, it's a good one.
Yeah. Thank you so much, Sarah, for sharing that with your personal experience. And we'll get back to Dr. Lux's comment and Dr. Tobias's comment in just a second. But I also remember you remarking that the veterinarian who had done this procedure for you, this was the first time that she had done it. Is that correct? And I didn't know about the challenges like doing, doing this hormone sparing sterilization, is that more difficult, complicated? Are there other sort of things that we have to worry about?
Absolutely. So I actually worked for the doctor who did the spay. I just kind of came to him and I was like, hey, would you be willing to do this for my dog? And I sent him the papers, and there was a video, showing how the procedure is done, and a step-by-step kind of procedure paper. And I just sent it to him and was like, if you don't feel comfortable, absolutely let me know. And he kind of looked over it and he was like, honestly, it's not much different than a traditional spay. It's really very similar. You're just you're being more kind of vigilant about where you're placing your ligations. And then, like I said previously, you're placing the ligations at the proper ligament instead of the suspensory ligament. And you do have to be a little bit more kind of gentle and kind of careful when you're handling the ovary and the ovarian bursa, because in a traditional spay it doesn't matter because it's coming out, but when you're doing this ovarian sparing spay, you do have to be a little bit more gentle because it is staying in. And so that's something to being taken into consideration. But I think it took about 15 minutes longer than his traditional spay, because I'd seen him done them before. And like I said, the only other difference was the incision was a little bit longer. I paid the same that other people pay for their spays at his clinic. There was no difference in price. And that's just, I think that's comes down to veterinarian preference. I probably would have paid more for it because it does take a little bit extra time and expertise to do that procedure. But I just think a lot of veterinarians don't even know about it. It's not something that's very commonly taught or commonly, talked about or offered in practice. And I guess I just want to answer Dr. Tobias's question really quick. So the only limitation for shows and events is a dog that is in heat. So dog shows and events, so conformation, if I wanted to show her conformationally, she does have to be completely intact. But I show in dog sports. So like I said, obedience, things like that. And you can have an altered or an intact dog, but you cannot show your dog when she is in heat. Luckily, that has not been an issue for me. For some reason, my dog seems to know when we have a dog show and decides to not be in heat then. So kind of works out for me that way.
Excellent. Thank you, Sarah. And actually, with that being said, and building this awareness, because I haven't been schooled on the nuances about this procedure, but Dr. Lux, are you available, or I don't know if you have any points to share about that VES abstract and any specific findings. Otherwise, we can share that kind of as a group.
Yeah, I'm happy. A few people have asked me to share the abstract, so I'll send it an email to the people that have requested it. And VES is Veterinary Endoscopy Society, so it's essentially minimally invasive surgery. So this paper was probably in publication. I'm not sure if she's waiting to get longer term results, but when she presented it last year, she's from Washington State. Her name is Boel Franson. So she had done just a hysterectomy with a 3-port minimally invasive technique and a vasectomy with the 2-port technique laparoscopically as well. She did, 17 female dogs and 8 male dogs. Only one of the 17 females had to go on later to have the ovaries removed. But none of it was due to medical conditions, and it's only about a 2-year follow-up. So, realistically, could there be medical conditions that pop up later for the females? Absolutely. But interestingly, 5 of the 8 males, so over 60% of them, had to undergo full castration afterwards, all because of behavioral issues with the intact status. So, I think if this is a procedure that we're considering, it probably isn't right for the shelter if we're trying to, at least for male dogs, trying to guarantee that they're getting homes. If their behavioral challenges, are they more likely to be euthanized in males if they've undergone the vasectomy? Whereas in females, the behavioral part didn't seem to be much of an issue. So, I think it was really interesting for all of us that they had such good outcomes as far as medical issues went, but definitely for males, behaviorally, it was a problem.
Perfect. Thank you very much, Dr. Lux, for that summary. And yeah, if you're able to get that out, I'll share it as a whole with all of our documents. So wonderful. And kind of going on to this, since we're running out of time with this rich discussion, wanted to, because Dr. Hart is obviously, he's a board certified behaviorist, one of our founding members. And so he obviously has a lot of experience about behavior disorders in our dogs. And we have Dr. Albright, our behaviorist here at UTCVM. And Dr. Albright, I didn't know if you had any comments to share or questions to ask of Dr. Hart.
Yeah, behavior has not really come up yet, but one thing I really try to make sure I'm still hearing all the time that neutering, just kind of a blanket statement that fixing animals is great for behavior, and that is a myth and it needs to be addressed. And I think that was really interesting, Dr. Lux, you were splitting it up. And again, please correct me if you feel like these statements are incorrect, Dr. Hart, or the Harts, that, males, yeah, it seems to be, I think there were some papers that there may be a slight increase in anxiety in males that are neutered, but we really need to stop saying that anxiety and aggression will be improved in females. I have many cases in my caseload of aggression beginning after, or huge upswing after the spay. And so as far as I know, we don't know the hormonal mechanism behind that. I'm a Dr. Hart. Dr. Haupt was my mentor, and she was always pretty, progesterone, the lack of progesterone potentially being a culprit. But yeah, so I'd love to hear your thoughts on that, because clinically that's definitely what I'm seeing. And then we've got the Peachy and O'Farrell paper, the Korean military dogs. There's some small papers, but some evidence that, to back that up.
Yeah, Dr. Hart, do you have any comments on the effect of
question? With regard to the male, from our work that goes back, a couple decades, more than that even. With regard to males, if say you delay neutering them, so then get to be about 3 years of age and they start showing aggressive behavior. So then you say, okay, you're going to, neuter the animal at that age. You get about the same likelihood of markedly reducing the behavior, about 25% for aggressive behavior, as you would in preventing it by neutering at 6 months. So in terms of males, I don't think there's any particular advantage to neuter them very early. The female, it's an interesting point with regard to the post-spay increase in anxiety and problem behaviors there. And I haven't seen a paper that addresses dealing with that, any kind of hormone replacement treatment or whatever. So I agree with Dr. Hopp. It just seems to occur in some of the females that are spayed. I can't offer any suggestion on that one.
So maybe Dr. Lux, we can do a big study where and Dr. Tobias, we do some of these hormone sparing, and we sort of look at this. But yeah, there's not enough people doing that.
Yeah, so many really great questions, but especially behavior.
Yeah, is one of the things I might mention about the spayed and neutered animals live longer. There's 2 large studies that document that they live a bit longer. And if you look at the details there, they die more frequently. the spayed and neutered animals die more frequently of cancers. Cancers much, so it's just consistent with what we're talking about. But the neutered animals, the intact animals, excuse me, the intact animals die of trauma and infectious disease. Now, trauma, they don't say, but the only thing I think of is getting hit by a car. So maybe the animals that fall into their database are more running around loose and getting hit by cars. That's one thing. Or they're mixing with other dogs and picking up infectious disease. And that's what's killing them. Not in my mind, not because there's something magical about spay and neuter that allows the animal's lifespan to increase. So.
Thank you for that. So everything's so multifactorial and dependent on their lifestyle with these outcomes. I guess, and so there's so much again to talk about, but before we leave, because we're in our last few minutes, but wanted to bring on Dr. Rollins and also Dr. Kirk, if she's available, from our nutrition team, because we haven't really, I know that you mentioned a little bit about obesity and spay neuter, but there's always these myths about if you get your animal spayed or neutered early, they're just going to be fat logs and just sit on the couch. So didn't know if Dr. Rollins, if you're still there and have a minute to spare with us to provide any comments.
Yeah, I mean, we have studies that suggest that spaying and neutering is going to reduce our basal metabolic rate by somewhere around maybe 20%. And, you know, that could certainly be a risk factor for obesity. I'm sure there's some breed predispositions there as well, because certain breeds seem to be more affected with obesity than others. But I just wanted to see if you had looked at or have any thoughts about doing a delayed spaying and neutering, does that seem to reduce risks of obesity a little bit later in life or not?
Yeah, Dr. Hart, if you're there, about the whole issue about delayed spaying and neutering and obesity. Have any thoughts to share? It might be off for a second. Dr. Rollins, what are your comments on that? What are your thoughts?
I don't know, because I know ultimately, yes, I see higher incidence of obesity in spayed and neutered animals for sure. It is a lot less common to have an intact animal that is overweight and obese. But as far as, if you delay spaying and neutering, does that have an effect, or are you just going to kind of have those same obesity factors creep in a year or two after even a later spay or neuter? It's kind of the question that would be interesting.
Yeah, I don't know the answer. The Morris Foundation is looking at obesity in the golden retriever study, this prospective study, and they find that that obesity is a prominent part of being spayed. But whether, I think your question is, I'm not sure if I'm hearing, but would an early or later spay or neuter affect the obesity thing?
In a different way,
yeah. And I just don't have an answer to that one, because I don't know enough about the effects on the metabolism.
But that's a really important question.
Yeah.
For follow-up work. Yeah.
Yeah.
Absolutely.
New research studies to be done. So thank you.
Exactly.
Oh, yeah, right. Yeah. It's kind of like the urinary incontinence question. If you do it early, you're much more likely to run into urinary incontinence. So, there's obesity, body weight, and urinary incontinence are some side issues that people don't pay that much attention to in the research so far.
Yeah, really a whole lot of room for more work to be done. And I thought that it was interesting that you found in your study that there was not a specific correlation between obesity and joint disorders, which is something that we kind of have as a foundation. And I know that we didn't look at osteoarthritis, the incidence of osteoarthritis in these cases, because we always talk about how obesity and osteoarthritis goes hand in hand. But yeah, I was wondering on your thoughts about if you think that spaying or neutering might have any effect on on osteoarthritis rather than the hip dysplasia, elbow dysplasia.
Yeah. A good question, and I don't know. We did try to look at some osteoarthritis in just a sample of our dogs, and didn't see anything that we could follow up with. We couldn't see anything that popped out between spay, neuter, and osteoarthritis. But the weight, all you can do is extrapolate from humans, I think, at this stage.
All right. Well, with that being said, I think that we are just about out of time. So I think that if anybody has any final comments or any burning questions that you might have for the hearts, while we still have them for a couple of minutes. Otherwise, Dr. DeBolt, did you have something else to add specifically?
Yeah, I just had some questions with the vasectomy and the ovary sparing surgeries and stuff like that. Dr. Hart had mentioned, maybe doing the vasectomy and going back and doing a neuter. All of this really brings to my mind cost, and that we're really privileged to be here to be able to talk about these options today. And from an ivory tower perspective, and like after being in the private practice world for a long time, I know a lot of people wouldn't be able to afford, they balk at a $200 or $300 dog spay bill when it was less than 6 months old. And so I know an 80-pound dog spay is going to be a whole lot more. And then we're also, if we consider the hormone sparing, which I think has an awesome place, but we're lucky to get to talk to our owners about that. A lot of our students going out into private practice, I've watched owners just shut down when I try to give them multiple options. So we talk about educating the owners or giving them all these options, but I definitely experienced, even when I went back into private practice a few years ago, if I laid out all of this stuff to an owner, all of their options and the risks and benefits, it's definitely overwhelming for the general person. So, I mean, look at us going around and around. So, so just to, that doesn't add any clarity to the conversation, but just to bring that real world perspective that I've definitely had out there too. So it's going to be a conversation for a long time.
No, you raise a good point. I just think that the veterinarian can find their way through this morass of data and ideas, and they coach or guide the client. Here's the way I interpret this for your breed and the sex of your breed and the age, and here's some suggestions. So I think you don't expect the clients to kind of find their way through this, but I would like to see the veterinarian be in a position to play a role and help them see through this.
It's also a question of really sizing up the client and knowing which clients want to have all those options and want to know all those details. And they're out there, I can tell you, because like yesterday, Ben had 3 emails with questions from clients, and clients are asking him very specific questions about adding hormone replacement therapy to their animal that was already neutered or things like that. So it's important to have, for the veterinarian to have that full array, and then to be able to notice which clients would really benefit from having those options.
Wonderful points, and excellent points to end on about having that, really developing that veterinary client relationship, is that every animal that we have is an individual, and we as veterinarians are there to kind of inform and educate our clients for the best of our abilities in the knowledge and with the data that we have currently at hand. And hopefully that we will in the future be developing a little bit more. So thank you, Dr. DeBolt, for giving that.
One more little thing to mention about the importation of over 1 million dogs. When you talk with owners, almost inevitably, the first thing they will tell you is, I rescued this dog. It is so important to people that they believe they rescued the dog. And it's a kind of real distortion these days, because so many of the dogs coming in from Korea and wherever are coming in, and people are going to their local shelter and getting those dogs and believing they rescued it. But meanwhile, they're ramping up the meat market in Korea to push out more exports of dogs, and they can get money for those. So we're creating a market in some Asian countries for their export of dogs to our American pet owners who want to believe that they've rescued a dog.
Yeah, that really ties into their identity and what they are as an animal rescuer and things like that. So really important. There's so many factors to consider and so many directions that we can go with this, which is really exciting. So I think that this talk has stimulated so much within the college. So thank you, Dr. Ben and Lynette Hart, for being here and joining us today, because out of this, what we're gonna
a lot too.
Yeah, great. Well, I'm glad that you could join in. But what will come out of this is that hopefully we are going to, with UT, will kind of come together with some sort of statement about the clinical interpretations of the data that you have. So based on this talk and based on like future ideas for research and everything, I think that we're going to have a wealth of knowledge. I also wanted to, but before we end, I think, or we can end right now, but I think Sarah had one more last quick comment that she wanted to close up with. And Sarah, if you were there.
Yeah, it was more about like what Dr. DeBolt was saying. Like, I absolutely agree. Like, this isn't for, every dog. This isn't for every dog owner. And it is a very privileged thing. I guess, I just really think that more veterinarians should be aware of it. I've had several veterinarians not even be aware of the possibility of this as an option. And so, owners who are educated and owners who might be in a place who want this procedure, come to their veterinarian wanting to talk about this, and either they may get shut down or get discouraged just because of a lack of awareness about the possibility. And so, like, absolutely, just like any other option or any other age, there are pros and cons. And it is a privilege. It's definitely not for every owner, because it does take other, special requirements and special responsibilities. But it's more just about like educating veterinarians. So if a educated owner does come to you and say, this is something I'm interested in, you can talk about this and be aware of it, and just be able to converse about it and say, okay, this is why I don't think it's a good issue, like a good alternative for you, or this is why it is. And yes, I would love to help you find someone who can do this procedure. So that was all I wanted to say.
Thank you very much, Sarah. We really appreciate your personal considerations and your input on this. So lots of really great, wonderful discussion. Thank you everyone for being here, for our presenters for today, for Dr. Hartz for being here, and for the rich discussion from everybody. So hopefully from this, we will have this presentation recorded so you can share with all your friends and whoever else needs to be educated, and kind of what we can share out with the world. And hopefully soon that we will come out with some guidelines from UTCVM as a whole. But with that being said, we'll end off for the morning. Thank you again to everybody. Thank you, Dr. Ben and Lynette Hart. It was wonderful to have you. So hope everybody has a great rest of your Tuesday, and we will see you around. Thank you so much. Bye-bye.